Hello and welcome to our videos on arthritis. This a chronic condition affect the joint and cartilage in the skeletal system. There are two main types of arthritis, arthritis and rheumatoid arthritis. Osteoarthritis or OA is caused by wear and tear, while rheumatoid arthritis or RA is an autoimmune disorder where the body attacks itself. The exact cause of RA is unknown. Arthritis can occur in two or more joints, causing pain and stiffness. It is important to seek medical attention if you experience these symptoms. Management of arthritis can include medication, physical therapy, and lifestyle change. So the signs and symptoms of the arthritis. Arthritis is a common condition that affects the people between the age of 25 to 34 years old, as well as those over 70 years old. It can impact any joint in the body, either on one side or both sides. In the early stage of arthritis, there may not be any pain, but you may experience some crepitus or cracking sound. With the movement, the pain typically relieved with the rest, and it is usually localized to the affected joint. Some other common symptoms include morning stiffness and decrease the range of motions. If you are experiencing any of these symptoms, it is important to consult your healthcare professional for a proper diagnosis and treatment, or your family doctor. So muscles involved in the some common use joint of the body. First, let's take a look at the knee. Here, we have the quads, hamstring, gastrocnemius, adductor muscles, peroneal muscles, and tibialis anterior and posterior. Moving on the hands, we have the extensor and flexor muscle, specifically the proximal, interphalangeal, and interphalangeal joint. Now, let's focus on the spine, where the erector spinous muscles, motivated muscles, QL, and lats help with movements and stability. Finally, in the hips, we have the glutes, hamstrings, quads, and pinus and iliacus muscle. Understanding these muscles and their function can help improve your overall joint health. So we will discuss AROM, PROM, and PROMM testing. First, we will start with AROM testing for the neck. This includes the flexion, extension, lateral flexion, and rotation. Next, we will move on to the spine, where we will test the flexion, extension of the trunk, lateral flexion, and lateral rotation. For the hands, we will test the radial rotation, ulnar, deviation, flexion, and extension. Lastly, for the knee, we will test the extension, flexion, external, and external rotation. For the leg, remember to perform these tests carefully and accurate for unaffected evaluation. Now we'll do the Sperling test. So Sperling test to the assist to the compression of the cervical nerve root or fasten joint irritation. This test is typically used diagnosis conditions such as herniated disease, arthritis, or nerves impingement in the neck. To perform this test, have the client sit down while you stand behind them, then instruct them to slowly extend and their neck side bend to the affected side, and then rotate their head towards the side. If the client experiences pain or radiating pain down their arms, the test is considered positive, indicating a potential issue with the cervical nerves or face joint. How to give a massage for the clients. For the best result, it is important to position the clients on the table according to their comfort level. Our goal is to decrease the pain, inflammation, stiffness, edema, and spasm, while increasing the circulation and range of motion. To begin, we ask the client to do DDB, which stands for Deep Diaphragmatic Breathing. This helps to promote the relaxation and prepare the body for the massage. Next, start by using long stroke with a moderate pressure along the length of the muscles. Remember to check with your clients and adjust the pressure as needed. For the next video, I will demonstrate how to massage the knee. So obviously, we need to warm our hands, and you can do some friction all around the knee. To never want to push directly down on the knee. That's a big no, especially for the people that having a surgery. So you want to do some warm up around the knee. You can do some circle. You're piling with a thinner your hands. You can do some finger, like a piggy bank finger, the small little circle all around the knee. So this is also getting close to the knee without putting much pressure. And then you can do some cross friction. Remember, don't make too much pressure on it, because there is a client having surgery or pain. So that's all. Thank you. So for hydrotherapy for the pain reliefs, today we will be discussing the use of hydro during your session and self-care during the acute stage. I recommend using cold or cold hydro while in the subacute stage. Contrast hydro can be beneficial. As for the chronic stage, I suggest using hot gel pack for moist hot towel. Now, for self-care, I highly recommended warm bubble bath with Epsom salt, as it promotes relaxation. However, if there is an inflammation present, a cold bath or spray or even cold pack on the affected area can provide relief. For self-care for our clients, I would like to talk about this remedial exercise for the knee. These exercises are specifically designated to help with any discomfort or pain in the knee area. The first exercise I want to show you is the standing squat stretch. This stretch targets the squat's muscles and can be done for 2 sets, holding for 10 to 15 seconds. 4 to 5 days per week. It is important to remember that this stretch should not cause any pain. So listen to your body. I recommended doing this stretch for 2 weeks and then progressing to adding intensity and stretch exercise. As always, consult a doctor before starting any new exercise routine. So that's it, guys. Thank you for watching my short video today. I hope you were able to learn something new and useful. It is always a pleasure to share knowledge with others. Remember, learning is a continuous process and there's always something new to discover. So keep open your mind and never stop seeking knowledge. Thank you and have a great night, everyone.